Hi, my name is Dr. John Heyer, and I'm a holistic chiropractor in Frankfort, Illinois. Tonight, Dr. Harry Kunelis and I are going to give you a brief presentation on TMD, also known as temporomandibular disorder, which basically encompasses headaches, neck pain, and jaw pain. Some of the symptoms that are associated with TMD include headaches, neck pain, jaw clicking, migraines, grinding of the teeth, numbness, and tingling. Now, some of you may say, well, I have that. Do I have TMD? Or my cousin has that. Does she have TMD? Well, not everyone who has these symptoms have TMD, but when you have a combination of these issues, you might be a sufferer from TMD and TMJ issues. Now, let's take these individually. Let's look at headaches. According to the Journal of Occupational and Environmental Medicine, 7 million working days are lost per year because of headache-related problems. Well, think about that. What do most people do for headaches? They take aspirin, Tylenol, ibuprofen. They take some type of medication to mask or cover the symptom when they really may not be getting to the true cause of the problem. Now, pain and TMD. Pain conditions associated with the hard and soft tissues of the head, neck, the face, and all of the interoral structures. What is the prevalence of this type of problem? Prevalence basically means how many people have this type of an issue. According to the Journal of American Dentist Associations, a survey of over 45,000 American households showed that 22% of the general population experienced one of 5 types of oral-facial pain, or mouth-face type of pain. 40 million Americans over the age of 18 have experienced oral facial pain in the last 6 months. That's a lot of people. That's a lot of suffering. And we're here tonight to give you an option to the drugs or to the surgery that may have been recommended that doesn't require medications or surgery and is much safer and much more effective. But is there something else going on in these types of problems? Well, according to the Journal of Dental Research, they reported that cervical spinal dysfunction, or in other words, a neck issue, a misalignment of the spine, is associated with TMD more frequently, being 70%, than TMD alone, only 29%. So let me break this down for you. Maybe you've been to a dentist and you were diagnosed with TMD, and maybe they did some type of procedure, ionophoresis, muscle stimulation, ultrasound, or maybe they gave you a generic bite plate or mouth guard, and maybe it got you some results. But in 70% of the cases, there's another issue involved, and that is the neck. If that neck issue isn't addressed, those other therapies are probably not going to be very helpful. Let's talk about the whole person approach first. Let's talk about the triad of health. As I mentioned, I'm a holistic chiropractor, so I really look at the whole person. If you imagine an equilateral triangle representing your health, there are 3 sides: the body structure, the body psychology or emotions, and the body chemistry. If any one of these 3 is out of whack, for example, if there are some structural issues, misalignments of the body, the neck, the head, the spine, they can affect the other sides. If there's a chemical or nutritional imbalance, they can affect the other 2. And of course, if there's an emotional issue, they can affect the physical as well as the chemical. I've never seen a happy hypochondriac, and they usually have some type of problem. Now, at this point, I'm going to have my friend Dr. Harry Kunelis, who is, in my opinion, the most advanced and progressive dentist in the whole southwest Chicago area. He's probably one of the few dentists that really have a handle on the TMD and how the spine is related to that issue. I'm going to introduce him and have him take over from here. Harry, come on up. Harry, say hi to our audience.
Audience, how are you? Thank you, Dr.
Pass that on to you.
I appreciate that. Following up where Dr. Heyer just left off with the triad of health, which is very important. Anytime we're looking at breakdown of the body, realistically we're looking at that breakdown in 3 broad categories. And like we said, the structural, the chemical, and what we call the mental, emotional, or psychological. So if we want to think simplistically about problems associated with the body, they're going to fall under these three categories. So what we really want to identify is the role of good posture and also why good posture is important. And the reason good posture is important is because every body movement, whether it's blinking of the eye or whether it's contraction of a muscle, requires a neurologic input. In other words, there's an electrical signal that fires to those groups of muscles to make that happen. And that electrical signal basically is coming from the central nervous system or the brain. So in essence, when we're looking at posture, we're actually looking at the brain and we're looking at the central nervous system. So when we see good posture versus poor posture, we can get an indication of what the brain and the neurology is actually thinking. So ultimately, good posture is where the head and the shoulders are aligned over the pelvis, and subsequently with a good base of balance over that central core. Also, we're going to be looking at another way to look at posture and what we like to call the lower jaw in relation to the head. This concept of posture in these buildings gives us a relative idea of the problems that are occurring when we evolve to start walking upright. In other words, as you become more erect, there are challenges based on gravity and other issues where the body is moving back and forth. There are challenges that are now about that we have to maintain a good sense of balance. And one of the best ways to get a symbolic representation of this is by looking at two very large, tall structures that get to a certain point where they require some form of balance in the upper floors in order to maintain this structure's ability to counteract sway and gravity. So what we'll do right now is we'll let you guys look at what we call good posture and ultimately what good posture will lead to, and then we'll work our discussion into how good posture is maintained. In other words, we see this picture as a static concept, but ultimately, how is this static concept function when the wind blows, when the earth quakes, and all these other issues? And what we'll find is that there are very close resemblances of this and the human posture, and we're going to talk about that next time for those of you that want to tune in. But for now, enjoy Dubai, and we'll see you on the flip side. Bye for now.